It is epic and I am excited to tell you all about it. I guess before we look at the impact the EPIC program has had, I should provide you with some background information. EPIC is a program which provides therapy for kids. The goal of the program is actually spelled out in the EPIC acronym. E represents early, the P, prevention, and the I and the C stand for in the community. Early prevention in the community. EPIC has a flexible approach in which efforts are made to break down the barriers which have made it challenging for people to go to therapy, such as having to take time off of work and/or school to go to a clinic or office. EPIC staff can provide therapeutic services to a child in the community. As long as the community space is one where privacy and HIPAA compliancy can be honored, distractions are minimal and focus is not challenging, therapy can be provided. This location might be at the participant's school, at the family home, in the backyard, at the library, a park, or at the agency's office, or some other place which provides both safety and privacy and where productivity for both the therapist and the participant can thrive. Come on, let's go inside and hear what EPIC manager Betsy Smith has to say about the program.
EPIC is designed to support kids and families who are showing symptoms of anxiety, depression, ADHD, grief and loss, aggression, and poor social skills. We hope to be able to connect to participants and families as soon as possible to prevent behaviors and symptoms from becoming more problematic, hence the name Early Prevention in the Community. We hope to provide the support, education, and advocacy to help address behaviors happening in school or in the home. Because of the Winnebago County Community Mental Health Board half-cent sales tax, we are able to bring these services to families and kids struggling with mental illness. We are able to address the barriers of finding and getting mental health treatment by coming to them, whether in the school, meeting in the community, or getting them to the Brightpoint office. We hope to make mental health services more accessible and assure that kids and families receive the support they are seeking.
That sound like good stuff to you? Want to hear more? Come with me. Look, the counseling services that Betsy told us about are offered to families when there is a mental health concern. Services are available year-round to such families with children between the ages of 4 and 18. In order to qualify for services offered through the EPIC program, families must reside in Winnebago County, Illinois. Did I hear you ask, why start so young? That is a great question. Early intervention is key. Therapist Charlie McDowell agrees. Right, Charlie?
Childhood, I would argue, is the most important stage of life. It's when we form our primary understandings of ourselves and the world around us. It's when we form attachments and learn how to trust. That is why early prevention is so important. When a child goes unsupported and unprotected, they are at risk of lifelong behavioral and physical health challenges. As a part of the EPIC team, my job is to work with children and their caregivers in the community to support healthy growth and development toward shared goals. I travel between schools, homes, and other locations within the community to best fit the needs of my participants. This flexibility is imperative as it helps to reduce barriers that many families face when trying to engage with mental health services. With the support from the Winnebago County Mental Health Board half-cent sales tax, our ability to provide services without fee further allows us to work within this community that are otherwise underserved and unable to receive mental health services at all. Nothing is more exciting than watching a child's confidence grow as they learn that they are not the sum of their problems, but are in fact the solution. Supporting healthy development of our children and their families is supporting the healthy development of our future. It takes a village to raise a child, and I am so thankful that programs like EPIC exist and that I live in a community that supports the facilitation of growth and healing among some of our most vulnerable community members. I hope that by addressing these challenges, our children have a happier and safer tomorrow.
I knew Charlie would agree. The sooner a mental health concern can be detected, diagnosed, and treated, the more likely it is that the disorder will not detrimentally impact the person's social, emotional, and physical well-being. Let's look at some of the service modalities used by the EPIC team. There is eye movement desensitization and reprocessing. There is also TheraPlay, and another modality used is a short-term treatment model called trauma-focused cognitive behavioral therapy. Another short-term counseling method used by the EPIC team is motivational interviewing. Through the implementation of these treatment modalities, the staff are supporting participants and having a huge impact. Here is what one of our EPIC participants had to say about their program experience. Thanks, Ariana, for agreeing to share your testimony about your experience with the EPIC program.
Services have been successful for us because she is able to receive them out in the community, and my daughter has a great relationship with her therapist. She is able to play, but also talk things through that she's been struggling with. Her therapist is patient with her and does not force things. She gets to work on coping skills, and her therapist is very responsive with any concerns. I would recommend and do recommend services to families in need. I love that sessions are not in an office setting, and also love that she's able to receive them during the summer months while in camp.
I am so happy to hear that you and your daughter have identified what is best and the therapist has tailored her services, including the location where the services are provided and the times you meet. Thanks again for sharing. So, if you were wondering if Epic Therapy Services can help to change behaviors, the answer is yes. In fact, they do. Look at this example of one of our many Epic success stories. She was able to participate in conversation without the pressure of eye contact, and she could identify feelings such as anxiety, sadness, and stress. And she was able to practice more coping skills, which were indications of positive progress. The clinician talked about how her consistency and trust made sessions helpful and less scary for the child, resulting in success. You may recall me having mentioned impact? Before heading out, let me highlight some impact we have made in the community and a few more things about Epic. From June 1st of 2021 to date, we have partnered with 152 families. Since June of 2023, we received 78 community referrals. In the first quarter, 77% of the participants who completed the Columbia scales reported improvement in the 6-month period starting at intake. In the second quarter, the same scale indicated 100% improvement. Third quarter reports of the Ohio scale indicate 75% improvement in the 6-month period, which starts at intake. And on average, 85% improvement is indicated, and 72% of participants report improved mental health and behaviors. I want to leave you with this. Our hours of service vary. The participant and family needs are paired with the therapist's availability. Services are available during the day, evening, and sometimes even weekends. Because we know that therapy models in which services are offered only once a month are largely ineffective, we ask that participants agree to meet weekly for services. Guess what? There is no cost to participants. You heard me correctly. Ready to sign up? Contact Brightpoint Manager and Epic Leader, Betsy Smith, for more information. She can be reached at the email address shown here. That's Epic.